Welcome to a crash course in disaster casework webinar. I am your host, Diane Elio with Catholic Charities USA. The goal of this webinar is to prepare and equip agencies, parishes, and volunteers to begin disaster casework immediately after a disaster incident. This webinar is broken down into 3 sections. Section number 1, we'll talk about some disaster basics. Section number 2, we'll talk about the what, when, why, who, where, and how disaster casework happens. And lastly, we will hear directly from our network partners who have not only experienced disaster casework, but disaster case management. So with that, let's start section number 1. In this section, we'll give you a definition of a disaster. We will discuss the phases of a disaster. We will speak about the declared versus a non-declared disaster. What are the emotional phases of a disaster? The sequence of delivery and declared versus non-declared, and who are those disaster players? So, definition of disaster. Let's start there. A sudden great misfortune, especially something such as a flood or a tornado or a fire that happens suddenly and causes much suffering or loss. So let's talk about the 4 phases of a disaster. You've got preparedness, the response phase, the recovery phase, and the mitigation phase. And please note in the middle of the circle, it's an ongoing cycle. So for instance, if you see the red starburst, that would be an incident. That would be when a tornado hit, that would be when a hurricane hit. If you look down in the teal box, that is the response phase. So that is where life and safety are first and foremost. It's where the situation is being stabilized. There's preservation of property. People are being evacuated and putting into shelters, and that is where mass care takes place. And it's also in that phase where disaster case work comes in. Now, if you move to the left in the orange box in the recovery phase, that is more of the long-term aspect of the phases of a disaster. That's where there's more economic recovery, there's debris management, housing, health and social services become a player, and that's where it's more long-term, and that's where disaster case management takes place. But if you look above at mitigation and preparedness, those are the activities that should always be ongoing. You've got the mitigation, which will really help be prepared and lessen the impact of the next disaster. And preparedness, again, should be an ongoing exercise. Now, this is just another viewpoint of the phases of a disaster. Really the same concept in just a different view. If you look along the bottom, again, you've got the disaster, but the preparedness and mitigation, that is an ongoing activity. But if you look at the response phase, again, up top in red, that is where the disaster case work comes in, and interim and long-term recovery, that is where disaster case management takes place. So disasters can be declared or they can be non-declared. So what does that mean? So a non-declared disaster is where the post-disaster relief and the recovery needs, they don't exceed the capacity of the county or the state to respond, and it does not meet those established thresholds for federal resources. Now, in a non-declared disaster, the resources will be limited. In a declared disaster, if the destruction has overwhelmed the community, the local government, they can request help from the state. And then if the state is overwhelmed, the governor can request help from the federal government. And the president may approve a federal disaster declaration for the state. This is an important view of the emotional phases of a disaster. If you look to the far left, pre-disaster, you have a warning and a threat. And as you follow the red line down, that's where the impact takes place. And you can see during that heroic phase, that's where neighbors come out to help. That's where people are donating money. That's where there's a lot of coverage on the news. So you get to that honeymoon phase, and then all of a sudden, what happens is the community can become disillusioned. Like, where's all that money we heard about? How come nobody's here to help me? So you can see the line starting to go down. There's some ebbs and there's some flows. And there's some trigger points where there might be an anniversary of the event. So that might cause some reactions. But if you look to the right, and as that red line starts to go up, you can see that's the reconstruction phase. And that is where your disaster case management comes in. That's where hope starts to happen. And if you look at that green arrow down below, to the left, you can see that can be up to 1 year. And then the green line to the right that's after an anniversary event. And that's when things start to really pick up. And that's where recovery really takes place. So sequence of delivery. What is sequence of delivery? The sequence of delivery must be followed when providing assistance to disaster survivors following an incident to ensure that they receive all of the assistance which they are legally entitled. Let's take a look at it. So in a non-declared disaster, you see you've got voluntary organizations, you've got insurance and personal resources, and you've got voluntary organizations at the end. So really what this means is at the very beginning of a disaster, you'll have your voluntary organizations doing the mass feeding, the sheltering, emergency assistance. They'll be helping with medical needs, the cleanup and muck out. But then when it comes to resources, next, a survivor is going to have to count on their own resources, whether it be homeowners, renters, flood insurance, earthquake, fire, or even if they have their own personal resources, such as their own money to help get them to be recovered. And the last piece of that in the sequence of delivery, once all that's been used up, it'll be the voluntary organizations that stand up disaster case management with rehousing, and there'll be long-term recovery groups that have formed to help really meet those unmet needs. So that's the sequence of delivery in a non-declared disaster. Let's take a look at a declared disaster. So just like prior, you've got your 2 yellow boxes, which are the voluntary organizations at the beginning and at the end. You also have insurance and personal resources, but now with a declared disaster, you have additional resources in the form of FEMA and SBA loan programs. So more resources, but what is the same is that it always starts with voluntary organizations and it ends with voluntary organizations. So disaster players. What other organizations may become partners in disaster case work and disaster case management efforts to assist individuals and families in their recovery? You have government partners such as federal, state, and local. You have partners in the private sector such as Lowe's, Home Depot, Airbnb. You've got non-government agencies or non-government organizations, we call them NGOs, such as Habitat for Humanity is an example. You've got faith-based organizations like Catholic Charities USA. You've got churches and synagogues. You've got national and local VOADs. VOADs are voluntary organizations active in disaster, and each state and territory has a VOAD. And again, you've got Catholic Charities USA, disaster players. So as we're going through this rather quickly, here's a resource that might be helpful on our YouTube channel. It's called Disaster Basics. It's about a 23-minute video, and it'll do a bit of a deeper dive than what we're discussing today. And alongside of that, there's a Disaster Basics participant guide, which will be very, very helpful. It includes forms and checklists. So let's move on to section 2, the what, when, why, who, where, and how does disaster case work? So what is disaster case work? Now, the logo at the bottom is National VOAD. That's what we just talked about in the prior section. Their definition of disaster case work is that it's early intervention and is provided by skilled helpers who are aiding those survivors and taking those next steps into recovery. Disaster case workers provide accurate and timely information and referrals. They're linking survivors with services and resources to really address those immediate and anticipated recovery needs. And really, they help screen for disaster program eligibility, which includes long-term disaster case management. So when is it performed? So disaster case work begins immediately after a disaster and can last up to 2 to 3 months. And why is it done, and why is it important? Well, as we mentioned, it's initiated in that relief phase of a disaster response. It can address people's immediate and transitional needs. It provides information referrals. It provides that initial outreach to really identify who are the survivors. And more importantly, it helps identify who are the most vulnerable survivors. Again, It is initiated in that relief phase of the disaster response. It can help provide short-term planning. It helps prevent duplication of benefits. And it really does not require that continuity of care from that same caseworker. That's more disaster case management. But also, disaster case work helps track value and services for reporting purposes. And who can do disaster case work? It can be done by agency staff. It can be done by parish staff. And also, it can be done by volunteers. And where is it done? It can take place at the agency. It can take place at parishes, disaster recovery centers, community venues, but it can also be done remotely, whether it be by phone, and it can be done virtually. So how is it done? So disaster case work can include providing some in-kind donations, information, and referrals, whether it be food and water, hygiene kits, diapers, gift cards. I like to mention that it's always important to have a disbursement log of where the cards went, the card numbers, if possible, to get the recipient's signature. It also helps triage those immediate needs. And we mentioned an intake form, and we have a sample on this particular slide, but we also have it on our resources page at the end of this webinar on some intake forms where you can just get some basic information. And I also want to mention the dignity and the privacy of the survivor here. When disaster case work is done, it is important that the identity and the survivor name is kept private. People are vulnerable, and it's just really important that that privacy is honored. So now we're going to get some advice from our network partners. We have Daniel Altano, who's the Director of Communications and Disaster Services from Catholic Charities of the Diocese of Raleigh. We have Kaylin Young, who is the Director of Disaster Services with Catholic Charities Archdiocese of Oklahoma City. And we also have Alyssa Marlowe, who's the Director of Community Services with Catholic Charities of Central and Northern Missouri. We're going to ask them 5 different questions today. Number 1, how did conducting casework help you with your immediate response? How long did your disaster casework phase last? And what resources did you use to capture pertinent information? How did the intake form help you prioritize your service delivery? Who were your community partners during the disaster casework phase? And if you could only give one piece of advice to an agency responding to a disaster, what would that be? So let's start with question number 1. How did conducting casework help you with your immediate response? And we'd like to hear from Kaylin.
Following the last several events we've had in Oklahoma, it's been important to us to identify what essential resources we're going to need long-term for our survivors. And so by us going out and meeting with our survivors, identifying what those impacts were able to help us communicate with our donors. We have a lot of strong donors in Oklahoma, but they want to know the specifics of what it's going to look like for our long-term recovery. So by doing casework, getting out there, talking to survivors, what we see on the news, what we see on the media, what we see on Facebook may be different than what survivors are actually feeling on the ground with where they're at. Sometimes we feel like clients are really in need of housing, but when we get down to it, they're like, well, I'd have a solution for housing if I just had furniture and appliances, but I don't have those essentials in order for me to move in. So having that base knowledge of what a client needs is really important, and we can find that in casework.
Question 2, how long did your disaster casework phase last, and what resources did you use to capture pertinent information? And we're going to hear from our partner, Daniel Altano.
We have found the disaster casework timing varies a lot from disaster to disaster. Our goal has been to continue conducting disaster casework until disaster case management services are available. The length of time it takes for disaster case management to get up and running varies based on the scope and scale of the disaster, other community agencies' capacity to implement disaster case management, and the possibility of a FEMA disaster case management program being rolled out. We have found success when we've had long-term recovery groups that have maintained capacity with volunteers to conduct disaster case management to bridge that gap until more formal disaster case management may be deployed. When conducting disaster casework, we utilize intake forms, a training for volunteers, and a data system to record all of the information in.
Question number 3. How did the intake form help you prioritize your service delivery? We're going to hear from Alyssa Marlowe.
The other Catholic Charities agencies across the state to create one unified intake form that we use at multi-agency resource centers, that we use when people call our office and are in need, or if they walk into our office. Our intake form helps tier households, just kind of like if we were in that disaster case management program, and you are trying to tier to identify needs and how to prioritize clients and vulnerabilities. So we were looking at vulnerabilities and ensuring basic needs were met first: food, water, shelter. And then once we had those basic needs met, then we would go further with households.
Question number 4. Who were your community partners during the disaster casework phase?
We conducted disaster casework in 3 different ways. We worked at shelters, we worked at points of distribution, and we canvassed the community. For shelter work, we partnered with the American Red Cross and local county-operated shelters. Both were great partners. For points of distribution, we would partner with faith groups, other nonprofits, and local government. Anyone who was operating a point of distribution became our friend. Finally, for canvassing, we partnered with a local university and their social work department. We were able to recruit bachelor's and master's level students of social work to go out and canvass the community. Their background and experience in social work limited the amount of training that they needed and got them out into the community more quickly.
During the disaster casework phase, some of the biggest partners we have in Oklahoma is the American Red Cross and the Salvation Army. Red Cross does a lot of initial casework, getting clients triaged, getting basic services to them if they're able. And then the Salvation Army does a lot of the feeding for our communities. So those are 2 big partners that we work with. 2 of the great partners we have in Oklahoma, for example, are legal aid services that are on the ground with us and have a direct disaster team that we're able to refer to. We have infant crisis services in our big metropolitan areas that focus on children and infants and are able to provide that formula, bottles, diapers, and that's so important. And then we also have a great program called 21st Century Santa. And so it's an organization that is there for children, bringing gifts, toys, presents for anybody who needs it. And it really helps reestablish and help kids feel more secure. So they're a great partner we use after a disaster during casework.
Our community rallied together and we had almost a short-term recovery group that then morphed into our long-term recovery committee. These were different social service providers in the area, such as the community action agencies, maybe the St. Vincent de Paul societies, as well as our United Way. Our United Way was one of our greatest supporters. We had a great relationship to continue to receive 211 data as it came in to conduct outreach calls to households in need. So those were our great community partners, as well as connecting immediately with SEMA, letting them know from the state perspective that we are there to provide case work. And then long-term case management was a wonderful partner and relationship to establish at the very beginning, as well as working closely with the emergency managers.
And last question, if you could only give one piece of advice to an agency responding to a disaster, what would that be?
Work early in the response phase has been critical for us. In past disasters, we have found that if we don't connect with families early on and gather follow-up contact information from them, we may never hear from them again. Early casework, we have found, helps prevent families from slipping through the cracks and make sure there's a more comprehensive recovery for the community. To accomplish this, collaboration has been key. We typically lean on existing partner relationships with long-term recovery groups, COADs, and the state VOAD. If a disaster occurs in an area where we don't have existing relationships, we'll work with the state VOAD and long-term recovery groups that may exist to build those relationships and still partner in a positive way.
So the best piece of advice I can give any organization doing disaster work is to trust your partners and build those relationships. In Oklahoma, we could not do what we do without those agencies that we rely on to support us. to partner with us to bring these full services to our clients, because it is a community effort. And we always want to remember that the local community wants to support their own as well. So when you're thinking of community partners, don't just think of those large state ones that you see often, like the Red Cross and Salvation Army, but think of those local agencies as well, the local food pantries, the local nonprofits that really have a key into that community and a heart for what is going on the ground. Remember that they can be your biggest cheerleaders when you get in and you build that trust with those organizations.
My one piece of advice is that as we are part of this larger network, don't be afraid to reach out for help. There are so many experts in the field that want to help. Don't spend time reinventing the wheel. Ask for help, utilize the network, utilize the short-term immediate grant through Catholic Charities USA on their portal. Take some time to connect through the portal. They have wonderful YouTube videos to watch. I used their Disaster Basics. It's about a 23-minute video for all of my volunteers during the immediate response. I also used a transitioning from casework to case management video from the YouTube video channel for volunteers, just to have some understanding of the disaster lingo that's out there and what our role is as a Catholic Charities agency when we respond to disasters. Best of luck. We at Catholic Charities of Central and Northern Missouri are praying for all those impacted by the wildfires and hurricanes. Again, don't hesitate to reach out to the network to help. We all are here and want to help our sister agencies as best as we can.
I want to give a special thank you to Daniel, Kaylin, and Alyssa for sharing all of their advice and experiences with disaster casework. And in addition, we do have some resources we'd like to share. They are, 3 of them are on the CCUSA YouTube channel. We've got Disaster Case Management as a Disaster Response Strategy. What does it take? We also have the CCUSA Concept of Disaster Operations. And thirdly, we have Transitioning to DCM, all on the YouTube channels. We have your network partners and also National VOAD, which we spoke about in the very first section. And last, of course, we have Catholic Charities USA, and you could reach us at disasterresponse@catholiccharitiesusa.org. With that, that concludes a crash course in disaster casework. God bless you, and please know that we're here for you, and do not hesitate to reach out to us. Thank you.